Now, today we're going to be talking in depth about medicines that are commonly prescribed to treat common aches and pains, including arthritis, muscle pain, nerve pains, diseases or treatments for neuropathy, and other types of related pain diseases. So if you struggle with pain and you're being managed, if you're seeing a pain management doctor, if you're seeing a general doctor who's prescribing you drugs to treat or manage your pain, this is the episode you want to make sure you watch to protect yourself and to protect your nutritional levels. So let's dive into some statistics first and foremost on pain. I think it's important to kind of bring scope to this conversation because many people think the medicines that are being used to treat their conditions are relatively benign, meaning there are no tremendous or horrendous side effects that are basically worrisome or that even need to be worried about. And a lot of times your doctor won't have a good conversation with you about the side effects. So he's just kind of writing the script, handing it over to you, just assuming you're going to get it filled, but there's no in-depth about the potential risks of these medications. So to put kind of scope to this conversation, I think it's important to quote the ex-CDC director, Thomas Frieden. "We know of no other medication routinely used for a non-fatal condition that kills patients so frequently. We hope to see fewer deaths from opiates." That's the bottom line. They're really dangerous medications that carry the risk of addiction and death. Now that's just opiates. And we're going to talk about a lot of different kinds of pain medications today, but opiates are on the front line. Right now they're a lot in the media and they're a lot on the news because of the massive deaths and addiction that they're causing. Now if we look at this diagram here, what you'll see is kind of a corollary between the prescribing patterns of pain-killing medications overimposed with the quantity of deaths of individuals per 100,000 people. And you can see these two curves, the green curve representing the sale of pharmaceuticals, the yellow curve representing the amount of deaths. You can see that the curves correlate almost identically well. And so this is good feedback for us to understand that the more of these drugs are dispensed, the greater the risk of deaths that occur as a result of these drugs. And we can also see here in the second figure, and this is coming directly from the CDC's website here. So the national drug-involved overdose deaths number among all ages from 1999 to 2001, the most current statistical data. You can see the top synthetic opioids is this gray line right here. And you can see how from about 2015, that gray line has skyrocketed. Now you can see some of the other drugs that are listed here, like benzodiazepines in green. Okay, they've kind of stayed relatively flatline, no major change there, although again, still risks of death. And then antidepressant medications, very, very common as well. These are oftentimes used to treat pain as well. They're pretty flatlined. You can see this bottom line that represents antidepressants. And then you can see here the non-synthetic opioids, or natural opioids, in this darker blue curve here, which is indicative of this line right here. So it's really the big one that's increased the most here in the last decade or so are these synthetic opioids, fentanyl being kind of the main one that's on the market, both legally and illegally. A lot of people and a lot of doctors have turned to these prescriptions to treat or manage people's chronic pain, making the claim that these drugs are relatively benign. However, nothing could be further from the truth. So I think it's you understand that scope. As a matter of fact, another maybe good homework assignment for you to do if you want to learn more about this is there's a book, a really great book called Dope Sick. If you haven't watched it or read it, it's a good one. There's also a Netflix documentary if you have Netflix or watch TV. So there's the documentary called Dope Sick and there's the book called Dope Sick. Either one is a great read. It'll help you understand the bigger scope of this problem. Now, even beyond the problem of just opiate medications, there's also just a major problem with medications in general. So this was a major study published a few years ago in the British Medical Journal. And one of the kind of the summaries here is that medical error is responsible for 251,000 deaths per year. And what does medical error mean? Medical error does not mean oops, so much I made a mistake. Medical error can mean the doctor made a mistake, but this is also, medical error is also classified as proper treatment with unintended consequences. In this case, death, as being the third leading cause of death in the United States. So this was a study published in BMJ on the top causes of death in the US. You can see heart disease over here is number 1, cancer is number 2, but medical treatment is number 3. And I think it's important that you understand that, because so many times people go to their doctor and they just accept the drugs as treatment without questioning it, without questioning the safety, without questioning the efficacy, or without challenging for the potential for side effects. And because doctors today don't train in nutrition, there's no nutrition training in most medical schools. This is a topic you're never going to hear about from most doctors. I say most because some doctors do go and get postgraduate training on this topic and are versed in it and do the right things by giving their patients informed consent, but most do not. So, I mean, let's just ask the question of you guys watching. How many of you have gone to your doctor, been prescribed a medication, and your doctor sat down and said, hey, there are some nutritional consequences to giving you these medications, and we need to have a talk about that because this drug depletes X, Y, or Z nutrient, and I'm going to put you on those nutrients. How many of you have ever had a doctor sit down and have that conversation with you? Just raise your hand in the comment box. Say, yes, my doctor talked to me about it, or say, no, my doctor never mentioned it. Because when we look at these comments later, we're going to find that the vast majority of you are going to type in no. It's because it's not something that's commonly done. So let's look at some of the chronic use medications for, in this case, joint and muscle pain. So what we're looking at here, we're looking at common medications. One of the top classes, and this is an over-the-counter, so over-the-counter medication is can be still just as dangerous as prescription, in my opinion, even more dangerous, because when you're buying over the counter, a lot of times you don't get that conversation with your doctor because it's not there. You're just getting the drug or picking the drug up at the grocery store. So acetaminophen, also sometimes under trade names Tylenol, paracetamol, or Panadol. This class of medication used very commonly to reduce pain, also sometimes used to reduce fevers in individuals in acute fevers, but very commonly used for the treatment of different types of pains, muscle pains, joint pains. This class of medicine depletes glutathione. Glutathione is critical as a nutrient. It is the master detoxification agent for your liver. In other words, glutathione helps your liver take out the trash every single day. And if you don't have adequate glutathione, your liver can become bogged down. Remember that when you're depleting one of the primary agents that protects your liver, you're also subjecting yourself to greater reactions from your other medications, because many medications are metabolized by the liver. So if you're taking this chronically, depleting your liver, you run the risk of more side effects from the other medications that you might also be on. And so this is especially concerning for example, in elderly patients who maybe they're on 5 or more medications, and this may be one of the ones they're taking on a regular basis. So glutathione is depleted as a result of using these medications. Something else that we know that research has shown us is that when people have selenium deficiency. Selenium deficiency. So selenium's a mineral. You can learn more if you want to learn more about selenium in depth. You can watch my master class on it. But selenium deficiency is very common in people with pain syndromes. There's a lot of research backing this up, that when doctors look at selenium levels in patients with chronic pain issues, it's very common for selenium to be low. So take that one step forward. When we have somebody with chronic pain who has low selenium and they start taking acetaminophen, the increased risk of liver damage is very much an issue. One of the reasons why this occurs is because selenium regenerates or recharges glutathione. It has a glutathione sparing effect. So when we see people that are already low on selenium start these medications, one of the big problems is there's a greater risk that now you're going to incur the liver damage. So be aware of that. If you're taking this for any length of time, you might ask your doctor not only to measure your glutathione levels, but also to check your selenium levels at the same time. Now let's move into this next class of medicines, these opiate drugs. There's a lot of different types of opiates: oxycodone, hydrocodone, codeine, morphine, fentanyl, methadone, all examples of these types of medicines. Now, to date, just to be clear, there have not been any major studies on directly this class of medication causing vitamin and mineral deficiencies. Not directly, but indirectly there have been. And the mechanism is through this right here. You can see this class of medicines causes appetite suppression. Now, appetite suppression is going to lead to weight loss, which we see a lot, especially in the people that are addicted to these medications. We'll see muscle wasting and weight loss. It's because they're not eating. So they're becoming malnourished because of that appetite suppression. And so it doesn't necessarily, again, it's not a direct deficiency. It's an indirect deficiency through reduced caloric consumption. So that's one of the problems associated with this class of medications. But one of the other ones is this severe constipation. Now, severe constipation, what happens there when a person's not having regular bowel movements? When you're constipated, your poop stays inside of you longer, okay? And why is that a problem? Well, if you have a permeability or a leaky gut, so if your gut is leaking and your poop stays inside of you longer, that means that the poop leaks through those holes, right? Those holes in your gut, and creates a major shift in inflammation. There's been a lot of research on this in the last 10 years about the microbiome and the types of bacteria in the gut and the certain types of chemicals that these bacteria can make. So if your gut is leaking and you're constipated, it's allowing for a greater degree of time exposure to those toxins having access to your bloodstream. Some of these toxins are called LPS. That stands for lipopolysaccharides. These are bacterial toxins that are produced in the gut. They're supposed to stay in the gut. These toxins are like what's supposed to happen in Vegas stays in Vegas, or what's supposed to happen in your gut with LPS is supposed to stay there. But if your gut's leaking, these toxins damage the liver. And they're known or notorious for contributing to non-alcoholic fatty liver disease and liver damage. And we don't want that, because if we're damaging the liver with mechanisms associated with taking these drugs, and we're taking more drugs that are also processed by the liver, we end up with more and more potential for side effect along the way. And that's just not something that you want to expose yourself to. Okay, so let's move into some of the other more common medications for chronic joint muscle pain. Corticosteroids. These are big hitters. A lot of doctors, when patients have like herniated discs or neuropathy, or have intense, severe acute pain or post-surgery pain, they're going to get put on drugs like cortisone, corticosteroids, prednisolone. These medications are notorious for creating massive nutrient deficits. You can see here over to the right, calcium, potassium, magnesium, chromium, zinc, selenium, vitamins A, C, and D, as well as vitamin B12. All those deficiencies have been associated with chronic use of steroids. And so, problem with that, there's several problems with that. One of the problems associated with it is what we just talked about on that prior slide, which is this selenium. Right? I said that those that have selenium deficiencies that start taking drugs like Tylenol or acetaminophen have a greater risk of liver toxicity or liver damage issues, and these steroid medications deplete selenium. Now, it's very common to see doctors write a prescription for a steroid, but also for acetaminophen. And it's also very common to see doctors write a combination of not just one, but multiple of these. So NSAIDs plus acetaminophen plus steroids. This is not an uncommon combo. And sometimes it's, I know my son, who's gone through dentistry school, is now a dentist. as he was going through school, they were discouraging the use of opiates for the pain management in dental patients, and they were really hammering and recommending the combination of acetaminophen plus non-steroidal anti-inflammatory drugs. And so again, these drugs are oftentimes given in combination, and that's another important factor that you want to take into consideration. But again, back to steroids. Steroids deplete all of these nutrients. We know that, for example, magnesium deficiency can increase pain. We know that potassium deficiency can increase pain. We know that calcium deficiency can increase pain. We know that chromium deficiency can increase blood sugar, leading to slower healing. Remember, why are we on these pain medications? The pain medications are generally given because somebody's got trauma or injury or some type of chronic inflammation that's leading to the perception of pain, and these individuals aren't healing typically. So when we take a drug that reduces nutrients, and those nutrient deficiencies have an impact on how quickly or how effectively that person can heal, we're getting stuck in a trap. It's like a loop, right? You take the drug to treat the symptom then is suppressed, but the drug creates nutritional deficiencies that lead to new symptoms that create either the same problem that's being treated or create new problems that would interfere with the primary problem that was being treated in the first place. So again, it's a trap, it's a loop, or a trick. I like to call it a trick because although, look, I'm not opposed to people using pain medications when they're acutely in pain. I am opposed, though, to the concept of pain management where those doctors are not looking at underlying biochemistry of nutrition, they're not looking at diet, they're not looking at lifestyle, they're not looking at any of the factors that really truly matter about the management of pain. And we're going to talk some more about that here in just a minute, so stick with me. Okay, let's move into NSAIDs. NSAIDs also cause nutritional deficiencies. Examples of NSAIDs: aspirin, ibuprofen, naproxen, diclofenac, celecoxib, or coxib. These are the kind of the classic drugs that many people gravitate to lower fever, but also just over the counter to remedy pain. A lot of doctors pull these out. These are sometimes called COX inhibitors. COX inhibitors are just a subclass of non-steroidal anti-inflammatories, but deficiencies that these particular medications can cause: iron, potassium, vitamin C, and folate. Now, it's interesting again, vitamin C deficiency causes increased pain. Folate deficiency causes increases in pain. Iron deficiency causes increase in pain, as does potassium, as we said over here. So a lot of these deficits are linked, again, to increases in pain, and pain is the very thing that we're trying to treat. So it's important that if you embark upon the use of these classes of medications, you're aware of these deficiencies, and that you either do one of two or even three things. Number one, I would suggest that, first of all, ask your doctor to test your levels nutritionally, right? Test for these things. Look at them, test them. Why? Because if you don't ask, you won't know. And if you don't know, you could be setting yourself up for chronic pain. You know, once the doctor gives you these meds, and if they don't work very well, the next step in that process typically is they send you out to a chronic pain management specialist. And now you're really going to get trapped, because those guys, they never look at these things. They don't even acknowledge that these things are important. So you're going to be in a world of hurt, and you're going to become addicted, and you're going to have a lot of the long-term consequences of these medications. So ask your doctor to test your nutritional status. Number two, properly dose or supplement with these different nutrients. If you know the drug is going to cause you to lose calcium and magnesium, then you should be on calcium and magnesium in an effort to try to override or to reduce the potential of that side effect with that medication, so that you don't now pay the consequence of becoming deficient in those nutrients. The other thing I want you to understand about these two classes of meds in particular, beyond the nutrition, testing, and beyond the potential for supplementation, these classes of drugs, when combined, okay, so steroids plus NSAIDs equals gut damage. Now, I just told you a moment ago that with opiates, right? We said that opiates cause severe constipation, right? And when that poop stays inside of you longer, if you have a leaky gut, then you have the potential for a lot more damage to occur through LPS and other toxins leaking into your bloodstream, creating chronic inflammation, subsequently creating chronic pain. So this is especially true of you that are on this kind of trifecta. You're already, maybe you took some opiates and now you're trying to taper off those opiates using steroids and NSAIDs. These two drugs, when combined together, create massive amounts of gut damage. But even by themselves, steroids can create gut damage, and non-steroidal anti-inflammatories can create gut damage. Let's talk a little bit